Client-centered therapy according to Carl Rogers. The client-centered therapy, also known as person-centered or non-directive psychotherapy, was developed in the 1940s by the American psychologist Carl R. Rogers. It is one of the key approaches within the humanistic tradition of psychotherapy and is widely used in counseling and psychological support. Unlike methods that focus primarily on diagnosis, client-centered therapy puts the person and their unique experience at the center of the process. The core principles of client-centered therapy. Client-centered therapy is based on the belief that every individual has an innate potential for self-development and growth. Psychological distress arises when this potential is blocked, often by internal conflicts, negative self-perception, trauma, or a lack of emotional acceptance. The goal of this therapy is to restore internal harmony and support personal development by strengthening the person's self-awareness and self-acceptance. Carl Rogers identified 3 essential attitudes a therapist must embody. There's the congruence, the genuineness. The therapist is authentic, emotionally present, and transparent. Then there's the unconditional positive regard. The client is accepted without any judgment, regardless of their thoughts, emotions, or behavior. Empathic understanding. The therapist deeply understands and mirrors the client's inner world and emotional experience. And these attitudes create a safe and trusting therapeutic environment, allowing clients to explore themselves openly and initiate their own healing and growth. The therapeutic approach is accompany the client rather than giving him directions. Unlike other therapeutic methods, the client-centered therapist avoids giving advice, instructions, or interpretations. Instead, they take a non-directive stance and meet the client as an equal partner. The key assumption is the client already possesses the solution to their difficulties. The therapist's role is to facilitate the conditions in which this inner knowledge can surface. Common techniques in client-centered therapy include active listening and reflecting, paraphrasing and mirroring feelings, also clarifying questions and emotional validation, encouraging self-awareness and self-acceptance. This approach enables the client to engage in deep self-reflection, gaining new insights and developing sustainable coping strategies based on their own values and resources. Areas of application. When is client-centered therapy helpful? Client-centered therapy is suitable for a very wide range of psychological and psychosomatic issues, especially when emotional processing, self-reflection, or acceptance are key components of the healing process. Typical indications for this therapy: life crisis and periods of personal transition. Also mild to moderate depressions or anxiety and insecurity. Also with low self-esteem and identity issues. In relationship and interpersonal difficulties. grief and loss. Also with psychosomatic symptoms without clear physical cause. And in the personal development and self-exploration. It is also particularly well suited for adolescents and young adults navigating questions of identity, autonomy, or emotional maturation. Limitations and contraindications. When is caution warranted? While client-centered therapy can be highly effective, it also has its limitations. Since the process relies on the client's ability and willingness to engage in introspection, it may not be suitable for all individuals or situations. For instance, client-centered therapy is not indicated in severe cases such as acute psychotic episodes or manic phases, schizophrenia or severe dissociative disorders, unstable personalities disorders. Also, acute suicidal crisis or an active substance addiction, for instance during acute intoxication or withdrawal. Significant cognitive impairments that hinder reflective conversations. In these instances, other approaches such as medical interventions may be more appropriate or even necessary as a complementary treatment. Additionally, individuals who seek structures, guidance, or expect concrete advice may find a non-directive approach a little unhelpful. So, this is a therapy that puts the person first. The client-centered therapy is very powerful and still a compassionate approach that places trust in the individual's capacity for change, healing, and growth. It provides a safe, non-judgmental space in which clients can reconnect with themselves, rediscover inner clarity, and make meaningful life changes on their own terms. With love, Dirk Liesenfeld.